Hello friends, my name is Sumit Bhandari. On behalf of HealthInsuranceCA.com, I welcome you on this video. Today our topic is, do we need to buy a health insurance if we already have a group health insurance policy? I'll share something on the basis of my experience. I'm an engineer by my qualification, and I work in research and development industry for around 6-7 years. Then I got into insurance industry. I'm a certified black belt in Six Sigma in quality assurance from American Society of Quality. So over a period of time, I worked in different industries, and then I finally started on my own. So during my job time, when I was in corporate sector, we were provided with this group insurance, and that was somewhere around 2008 or 9. That time, most of the people, like, they were not inclined to buy health insurance. It was not very common. So in 2024, it's been like more than 15, 17 years. Things have changed a lot. People have become more aware. Things have become very costly. Insurance costs have risen due to various reasons. And but still, most of the people, like, who are working in corporate sector, they have a big dilemma, or there are a lot of wrong myths and perception about health insurance. So I'll just take a very simple example. Say somebody is working in a big company and they already have a group insurance. So normally they provide only 5 lakh rupees of cover. So this sum assured of 5 lakh, is it sufficient for most of the claims? Yes, it is. There is no doubt. So in case somebody is looking to cover 99.5% of medical contingencies, a 5 lakh cover is more or less, it is like quite sufficient, right? Now what happened? People feel uh, like, is it okay? My age is 35 or 40. I'm really healthy. I really need health insurance at a stage of, say, 56 or 60, So I can live without this expense, this burden, or this extra cost. Why should I buy a health insurance policy where I'm already covered for 5 lakh? Let me just take a very single example. It's a very practical example. On that basis, we'll try to see, do we really need a health insurance policy or not? Like, before that, I'll give you a bit of information. There are hundred of cases. There are certain situations where insurance companies simply refuse to give you a policy. You have 100,000 lakhs of rupees. If you have some health issues, insurance companies, their underwriting team, they will simply decline the risk. They will not give you policy. You already have some pre-existing problem. You have some treatment is already going on. You have some mental health issue. Maybe it is depression. It's stress-related medicine. You're taking medication for anxiety. You have certain illnesses before the age of 35, then many companies simply refuse. A reputed company, they don't want to give you policy if you have a big chronic health issue before the age of 35. You already have, your hemoglobin is below a certain time. Your child is diagnosed with, say, meningitis for a particular period of time. They will put up a waiting period. Okay, we will not give you policy for a few years, and once you fully recover, like, there are many instances where people are diagnosed with tuberculosis. Many instances company don't give a policy. So medical field is very, very vast. So keeping that risk, that like it is keeping that risk in mind, that we may end up in a situation where I'm diagnosed with ABC problem and company simply say will not give you policy. Now let us come to the actual question: do we really need a health insurance policy? Answer is yes. At what age? Whenever you're healthy in your life, you should buy a policy as soon as possible. I'll take an example now. Say somebody's age is 35, right? They have taken a job, and this guy is working in a company where they are given you 5 or 10 or 15 lakh rupees of group insurance. Yeah, normally it is 5 lakh. So now the guy feel like, okay, I don't need health insurance at all. And many people approach him and simply say, I don't want to take this expense. Let me continue with it. Say after, at the age of, say, 40, 42, 44, now this guy is diagnosed with few illnesses, like he develops some chronic heart condition. There is an expense of a single, it may or may not be a a heart attack, but simply this guy is undergoing some stress in life or stress in job or health is deteriorated. So he's feeling some issue related to breathlessness and he goes to a doctor. Doctor diagnosed your ECG is not okay. Let us go for echo and ultimately it is diagnosed there are certain arteries which are blocked and this guy need a simple operation, angioplasty is required, and a single stunt is given to them. So this single stunt operation it costs between 2 lakh to 3 or 4 lakh rupees depending on the city or kind of hospital you are going into. Say let us take it 2.5 lakh rupees. Now this guy is now there is a burden of 2.5 lakh which is group insurance is fully paid for. Now, practically understand now there are three implications. First of all, a person who is diagnosed with a heart condition, he or she will not be able to work with the same zeal, mental strength, physically. He or she will not be able to take that much of stress. So may or may not that person will change the job or they may not accept a higher position in later on in his career where like he don't want to take a lot of risk or stress. So the first thing which happen is the kind of income this guy is going to increase, make in coming 20-30 years that will reduce drastically. Secondly, now this person is very happy that health insurance supported me. Now this person will try to buy a policy for he go outside and he says okay 5 lakh is a okay amount, let me try to increase my cover. Unfortunately, if this person is classified as a heart patient, no insurance company will give him a policy of any sum assured ever. I'll repeat. This guy goes to SDFC, this guy go to ICICI, New India, he go to Star Health, he go to Royal Sundaram, he go to Future General, he go to any insurance company. If you are a heart patient, nobody will give you policy at all. Now what practically happened? This guy he is dependent on that 5 lakh cover forever. Later on say this person has a um, later on this person feel like okay I can port this 5 lakh group insurance into a retail policy, he can go, but now he or she if they live till the age of 80 or 85, can they beat inflation with with this cover of 5 lakh rupees? Impossible, it is not possible, right? Say somebody has a cover of 10 lakh rupees. This guy is diagnosed with cancer. Cancer has become very common. This guy is, when he or she is taking treatment for, say, 10 lakh rupees for cancer, which is very common in big cities these days. So it is a second example. The guy is diagnosed with cancer. Now he or she is taking treatment. Now cancer treatment goes for many, many months. Most likely now what practically would happen, the HR department will simply say now you're taking the treatment and will try to give you some compassionate package. They will give him say 5, 10, 15, 20 lakh rupees. People will contribute. There can be some sort of fund, and most likely this guy will be out of job. Now if he has not taken any policy at all, the moment you are out of company you have lost your job, right? Your cash flow has stopped and a cancer patient cannot buy a policy ever now. So practically what has happened in terms of financial planning, my recurring income, the cash flow has stopped totally. My expenses, EMIs, children expenses, if it is the rent, everything is still there. My income has stopped. I'm like taking treatment at home say for 6 months or 1 year, and when a person is like say this person get treated very well within say 3 months or 6 months, cancer patient doesn't have that much of strength. I'm not saying exceptions, like most of the cases people don't have that kind of mental strength, physical strength, or the stress bearing capacity where they can rejoin and work with the same zeal or enthusiasm. It is practically not feasible. So now once 10 lakh, say this person whose 10 lakh policy was there, this 10 lakh claim is paid by group insurance. Fine, that financial impact is not there. Again, this person becomes extremely healthy. He or she lives till the age of say 80. Now, they cannot buy any health insurance policy at all. So it is not necessary that a claim like a cancer, a claim like health insurance will disallow us to get a policy. It is possible a person at the age of 28 they get a head injury, and there is some big accident where the lungs are ruptured, kidney has some impact. People who have some chronic issues after COVID treatment, most of the people, like, they were not able to buy a policy now. So what happened, like, treat yourself as a company, you know, budget for certain kind of contingency. Health insurance is a must. Your age is 25, your age is 20, your age is 15, your age is 55, your age is 70. Everybody needs health insurance these days, right? Like some time ago on my Hindi channel, Health Insurance Sahi hai, we put up a video on health insurance and cancer, right? So what kind of cancers are covered, what is not covered. In that, somebody put up a remark that one of his friend or cousin, she got admitted in Delhi or Gurgaon, Noida, somewhere, and there was an expense of close to 58 lakh rupees. So I don't know what kind of treatment, didn't get into it. But in my life, like over last 15, 17 years of, I've been selling policies. We have been advising people. So a lot of claim experience which I have got, it is a real time data on the basis of, our own practical experience. So most of the time I have seen, like, the claims amount is very, very less than 5 lakh rupees. The people who got a claim, say 10 lakh, 20 lakh, 30 lakh, it is not very common. But a person who get that kind of claim, most of the people, they go bankrupt. I'll just take the first example again. The person has a policy of, say, 5 lakh rupees. He or she has a major accident, then there is a claim of 20 lakh rupees. So 5 lakh is paid by group insurance. Now this, due to lack of adequate health insurance cover, now 15 lakh has to be paid from this person's pocket. So how will we generate? Most of the people, even in industry, except people who have a lot of black money, nobody has that kind of liquidity. It can't be generated immediately. So that 15 lakh, most people have to take some sort of loan. They will borrow money from friends and all at a higher interest, or if there is no credibility in your society, then you have to sell something. It's a big financial loss, right? And these days it is extremely important to have a policy. If somebody feels like uh, there is a possibility, somebody feel like, okay, I have a 5 lakh rupees of cover, let me take a super top up. Taking two claims, taking a, say there is a claim of 9 lakh rupees, you're taking 5 lakh claim from New India, which is your group health insurance provider. Now you want to take a 4 lakh of cover from ICICI Lombard, which is your top up policy. It is a logistic nightmare. Just imagine, 9 lakh of claim is there, you're hospitalized, you know you or your family member, they have to take care of. 5 lakh is paid by New India, which is your group health insurance provider. Now after 5 lakh is finished, hospital will say you have to pay 4 lakh again, you have to pay another 4 lakh in coming, say, 5 7 days. Health insurance cashless claim for a different policy, it is a huge complicated risk, right? I'll make a separate video on it sometime. But understand, immediately hospital is asking for 4 lakh rupees, or say 50,000 rupees daily basis. That health super top policy may or may not work. It will give you claim, but at that moment most of the people, they need liquidity, they need a cashless claim, which is a very, very complicated stuff. It's like a logistic nightmare, right? So understand these things very, very well. We have been advising lots and lots of people. There have been a lot of misconception. 30% of the policy, which we have sold in last 15 years, those are government people, government servants. So these guys, they have a sort of, state health insurance policy, central government facility. Still, they buy a policy, because taking a claim from a government institution, it is not that easy. Many, I just remember a case. A client of mine, she is the finance secretary with Maharashtra government. Now she contacted me a few years ago. Now this lady wanted to buy a big policy for herself and her husband, who is in a village. Fantastic guys. So I had a query, like, why are you looking for this kind of policy? So she said, like, I am at a position where I have to sign, where I have to approve claims. for government servants. Now, a guy has spent, many lakh rupees on cancer treatment, and the maximum limit she was allowed to give to that guy is 6 lakh rupees. You know, so at that moment she, got shocked. So we advise her appropriately, like what kind of policy they should buy. Husband has certain health issues. She's going to develop some health issue very soon. Some symptoms are there. So accordingly, this thing is advised. Now, what policy, which company, that I will not get into it. But the important thing is, don't get into this uh, wrong mis-selling concept that you have a group health insurance, you needn't buy any policy, just buy a super top up. That is a wrong answer. Because, like, I'll tell you, though I'm putting this video on YouTube, I'm not bragging, but understand one thing: 95% of the people, like, who are very popular on internet, on in not into health insurance, most of the people, they don't have practical experience what works on ground. It is very easy to make a YouTube video, make very good studio, and blah blah blah. You can put up all kind of fundamental nothing. Health insurance, very very simple thing. The lot of misinformation which is being given, right? So I like just got a call from some client of mine, like his cousin, he wants to buy a policy. They're from Ulhasnagar, just around 10 minutes ago. They said to kindly suggest a policy for him. Like, I cannot. You have a tie-up with every company, you can recommend. Like, I don't know, his age is 25, 45, 75. How can I recommend? I don't know his paying capacity, what kind of health issue he has. It's not that simple. So they will fill up a format, they will send it. Only then I will be able to see, how much money he or she can pay, what is the health condition, genetic issues. There are hundreds of factors. Businessman, job class, what kind of position he or she is working in, cash flow. There's so many factors. And he say, like, you recommended me this policy 3 years ago. Can he buy same policy? Like, no, it is not possible. Your age is 39. His age is 47. You cannot buy same policy for him. It is not possible, even if it is your real brother. So everything has to be, recommended on basis of analysis. So that's why, like, I'll just share a little bit about the process which we follow. Right, you can visit our website healthinsurancesahi.com. There is a FAQ section. You can go for a blog. You can spend some time on services section. A lot of things are given there. How you can take our consultation. The only thing which we focus is, right, we'll give you consultation. If you're not happy with it, let us complete whole process. Even after that, you feel like, okay, we have not done a good job, we'll immediately refund the fee. We normally refund fees maybe once a year, but still, if somebody is asking for it, immediately refund without asking any question at all. you know like 95% of whatever we have done in last 15-17 years is we have a different team for selling policies. This consultation which we have been doing for last 7-8 years, it is only to provide a rightful, unbiased, honest advice. We'll advise you certain policies, buy from anywhere. I don't even ask you to buy from, you can buy from anywhere. There are certain people who insist they want to buy us. We don't do policy for everyone. There is a very strict criteria. Only in that case we'll do. So let us not get off from the topic. Whenever you feel like there is some money, extra money in your hand, go for a policy. And if you don't have some sort of funds or some spare money, buy a policy immediately. By even taking a loan. When my cash flow is very very tight, I don't have good supply of money, that is the moment when we need to buy a policy. It's not that tomorrow I will have some extra money, then I'll buy a policy. The right time to buy a policy for all of you is this moment. I'm not saying that approach us, buy from anywhere, buy from any kind of source, but by following up properly. But you have to buy a policy by following a particular process, right? Our next video will be on the basis of impact of GST, so we'll try to make it today itself. And if somebody likes the kind of information which you kindly like it and share this video with your friends on WhatsApp or any kind of social media platform, right? And just a request, share it with your friends if you feel it's a good information. And if you are looking for good content, if you feel like we have done some kind of good job, kindly subscribe the video, subscribe the channel. And every Sunday morning 11 o'clock we'll have a live session. You can ask any kind of question from us. Okay, on this video we will put up 11 o'clock Sunday morning, and later on we will try to make it frequently, maybe 2 3 days, 3 more weekdays. As per your suggestion, we'll fix up the time, right? Anyhow, thanks for your time. You have watched this video, and Jai Jai Shri Radhe.